There are types of gene therapy. First is somatic cell gene therapy, and the second one is germline gene therapy. Somatic cell gene therapy is a therapeutic genes transferred into the somatic cells. There are examples of introduction of genes into bone marrow cells, blood cells, skin cells, and etc. Will not be inherited later generations. At present, all research is directed to correct genetic defects in somatic cells. Germline gene therapy is a therapeutic genes transferred into the germ cell. Examples are genes introduced into eggs and sperms. It is the heritable and passed on to later generations. For safety, ethical and technical reason is not being attempted at present.
Basta save na natin. Sige.
Ito. Ano na yun? Embryonic stem cell. Embryonic stem cell and gene therapy. Human embryonic stem cell theoretically represent an ultimated supply of normal.
Ano lang po? Sige, okay lang kahit.
Ay, sige, okay. Huwag na natin.
Saka.
Embryonic stem cell and gene therapy. Human embryonic stem cell theoretically represent an ultimated supply.
Unlimited.
Ay! Unlimited! Oh my God! Unlimited!
Unlimited. Parang cellphone.
Unlimited.
1, 2, 3, 4.
Embryonic stem cell and gene therapy. Human embryonic stem cell theoretically represent an unlimited supply of normal, differentiated cells to engineer diseased tissue to regain normal function. Embryonic stem cells are pluripotent cells delivered from the early embryo.
Derived. Okay lang ka lang.
Derived.
Isa pa. Embryonic stem cells. 1, 2, 3.
Embryonic stem cells are pluripotent cells derived from the early embryo. Number 4.
So, 1, 2, 3.
Applications of gene therapy to human embryonic stem cell. The ability to produce genetically modified human embryonic stem cells expand the potential of human embryonic stem cells to correct hereditary disorders and deliver gene products for specific therapies. Strategies are being developed to enhance the safety profile of human embryonic stem cell transplant by incorporating genetic elements into the expression cassettes of gene transfer vectors to allow the use of external stimuli to suppress or eliminate uncontrolled cell growth. Use of gene transfer to control the differentiation and growth of human embryonic stem cells. To be useful in clinical applications, genetic modification of human embryonic stem cells may be carried out using multifunctional gene transfer vectors that include a selectable marker, a therapeutic gene, and suicide gene. Number 5. Ano na siya? Types of gene therapy. Germline gene therapy. and somatic gene therapy.
Ito na ito. Sige.
Pinas ko na.
Meron na tayo ng diba? Yan.
Basta ang tawag ko. Wala. Pakita na natin. Types of somatic gene therapy: ex vivo and in vivo. Ex vivo is cells are modified outside the body and then transplanted back in again. Called ex vivo because the cells are treated outside the body. In vivo, genes are changed in cells when the cells are still in the body. Called in vivo because the gene is transferred to cells inside the patient's body. Ex vivo gene therapy. First, isolate cells with genetic defect from a patient. Second, grow the cells in culture. Then, introduce the therapeutic genes. Then, select genetically correct cells and grow. And last, transplant the modified cells to the patient. Kasi ito, kapakita mo na. Hindi, pinas mo. Aka na lang. 6. In vivo. In vivo gene therapy. Direct delivery of therapeutic gene into target cell into patient's body. They carried out by viral or non-viral vector system. It can be the only possible option in patients where individual cells cannot be cultured in vitro in sufficient numbers. Examples are brain cells. Example is brain cells. Example is brain cells. In vivo gene transfer is necessary when cultured cells cannot be reimplanted in patients effectively. Effectively. Vectors in gene therapy. To transfer the desired gene into a target cells, a carrier is required. Such vehicles of gene delivery were known as vectors. There are two main classes: viral vectors and non-viral vectors. Tapos dito kung sinabi.
Wala pala ito ano.
May ano ito? Effect na sige ba baba? Viral vectors. Retrovirus vector system. The recombinant retroviruses have the ability to integrate into the host genome in a stable fashion. Can carry a DNA of size less than 3.4 kilobytes. Replication defective virus particles, and the target cells is dividing. Adenovirus vector system. Adenovirus with a DNA genuine or a good vectors. Target non-dividing human cells. Examples are common cold, adenovirus.
Example is, isa pala.
Example is common cold, adenovirus. Viral vectors. Adeno-associated virus vector. It is a single-stranded, non-pathogenic small DNA virus. Herpes simplex virus vector. Viruses which have natural tendency to infect a particular type of cell. They infect and persist in nervous cells. Non-viral vector system. Pure DNA construct. So direct introduction of pure DNA construct into target tissue. Efficiency of DNA uptake by cells and expression rather low. Consequently, large quantities of DNA have to be injected periodically. Lipoplexes. Lipid DNA complex.
Dito, may ano eh. Ito pa ba? 1, 2, 3. Lipoplex.
Lipoplexes. Lipoplexes. Lipid DNA complexes. DNA construct surrounded by artificial lipid layer. Most of it gets degraded by lysosomes. Non-viral vectors. DNA molecular conjugates. Commonly used synthetic conjugate is polylysine compound to specific target cell receptor. Therapeutic DNA is then made to combine with a conjugate to form a complex. It avoids lysosomal breakdowns of DNA. Human artificial chromosomes can carry a large DNA. Examples are with one or more therapeutic genes with regulatory elements. There are some disadvantages of gene therapy. These are long-lasting therapy is not achieved by gene therapy due to rapid dividing of cells. Benefits of gene therapy is short-lived. And immune response to the transfer gene. Immune response to the transfer gene stimulates a potential risk to gene therapy. Viruses used as vectors for gene transfer may cause toxicity, immune responses, and inflammatory reactions in the host. And also, disorders caused by defects in multiple genes cannot be treated effectively using gene therapy.
Ano yun? Paka-remember.
Eight. Eight lang pala. Kala ko na.
Parang hindi advantage. Sige.
Nabubulol ako.
Tips ko na. And there also have advantages of gene therapy. These are: gene therapy has the potential to eliminate and prevent hereditary disease such as cystic fibrosis, EDA or SCID, and etc. It is a possible cure for heart diseases, AIDS, and cancer, and it gives someone born with a genetic disease a chance to life. It can be used to eradicate diseases from the future generations. There are some ethical issues about gene therapy. There are some ethical issues about gene therapy. Who will have access to therapy? Is it interfering with God's plan? Should people be allowed to use gene therapy to enhance basic human traits, such as height, intelligence, etc.? Is it alright to use the therapy in the prenatal stage of development in babies? Tapos, yun, di ba? Ano? Baba lang yung boss ko dito. Gusto ko tingnan. Baba.
And we also have advantages of gene therapy. These are gene therapy has the potential to eliminate
Therapy.
Stop.